Hi, everyone. I'm Katherine Sanders from Sanders Consulting, and I want to spend just a couple minutes here talking about something that the World Health Organization put out this week. It was a recommendation about working less, that the hours worked above 55 hours a week are actually impacting public health. And the New York Times wrote a piece about it. It's called Working Less Can Save Lives. They published it on May 30th of 2021. And a number of the comedians, late night talk show hosts that week were making fun of it. And with good reason, right? They're like, well, it's obvious that too much work means too much stress, means people get ill. And I guess what I want to say about this is that, yes, I mean, we've known about this literally since the 1980s. The overwhelming research over longitudinal studies is that if you go above perhaps 50 to 55 hours of work a week, it puts you at higher risk for poor health outcomes like cardiovascular disease. It interferes with your immune system. It essentially just puts you at risk for anything that's associated with chronic stress health outcomes. So, and we know the physiology of this. We've known it for decades. You can watch a really cool YouTube video documentary by the Discovery Channel for free called Stress, Portrait of a Killer, and actually see the physiology of stress and how these long work hours translate into poor health outcomes. You can read books. This one was written by Stanford School of Business professor Jeffrey Pfeffer. It's called Dying for a Paycheck. I use it when I teach my programs about the design of work. It's not a perfect book. He is discovering that there is 100 years of research about how work impacts health. And so all of this is good. I mean, I'm glad the World Health Organization is promoting this fact that the way we work impacts our health and is a public health crisis. I'm so glad Jeffrey Pfeffer and his colleagues at Stanford wrote a book about it. And I think the biggest contribution of this book is looking at the economic impact on the United States society in our healthcare system, taking care of people who have been damaged by how they're asked to work. Not just safety, but also chronic stress outcomes, mental health issues, physical health issues. It is an epidemic, and I understand why the comedians are making fun of it, because it's sort of like drinking a giant sugary big gulp every day and then wondering why you're pre-diabetic. But I actually have more compassion for that, because I would say that the people who are smoking cigarettes or drinking big gulps every day or having beer every night to decompress or taking sleeping pills or taking antidepressants are actually coping with the work systems that we've created. So to take the big gulp away, to take the cigarettes away, to take away antidepressants or alcohol actually doesn't fix the problem. People are trying to self-medicate in large part because of the systems we've created, because of the way we work in the United States, because we ask too much of our people, and we've gotten to a place where we worship Lean and Six Sigma. As an industrial engineer, I have a PhD, a bachelor's and master's and a PhD in industrial and systems engineering. I appreciate statistics. I had 7 statistics classes in graduate school. There's power in these ideas, but when ideas of Lean and Six Sigma are driving people, and when understaffing becomes normal, then we are in an unsustainable situation. We have to use what we know about humans. We have to use what we know about work's impact on health, and we have to design work systems that actually are humane and sustainable for human beings. And this isn't only impacting individual health, mental health, and physical health. It's not only impacting the cost of healthcare and the workload of our healthcare systems that are trying to deal with all of these people that are coming to them with chronic health issues, in large part either caused by or exacerbated by the work systems that they are working within. But it's also impacting our families, right? I mean, so like coping can be the way we eat. It can be whether or not we exercise. It can be taking prescription drugs or recreational drugs. It affects our sleep cycles, but it also affects our personal relationships. And who more is affected than people in your family by your work, right? So they live your work with you. They listen to you when you come home all stressed out. They are the people who miss vacations with you or miss birthday parties with you or can't go to the theater because you've got to take another shift at work. When we underfund our work systems, where we move everything toward these toxic, destructive quarterly profit cycles, and we act as if we're profiting from our super lean systems that are actually doing damage to our people, we're also doing damage to the people's families. We're doing damage to the people's communities, because these people then are exhausted by the time they get home. They're missing out on the social support and restoration that they would normally seek at home, because perhaps their family's angry with them for being absent so frequently. They don't have time to volunteer in the community. They don't have time to be kind to a neighbor or to take care of a grandchild, because they're just overwhelmed at work. So we think with our short-term focus, our very limited scope, we're being efficient, but we're actually not being efficient. We're actually being destructive to not only individuals' physical and mental health, but the well-being of their families and their communities. We're putting an extra toll on our healthcare systems, and we are actually shortening people's lives and eroding their quality of working life. So although I know it can seem like a joke that the World Health Organization is saying that increased work hours over a certain limit impact health, it's not a joke. It's actually an epidemic, and we've known about it for decades. The research has been there since the 70s and 80s. It's about time we actually do something about it. So if you're interested in talking about what we can do about it and how we go about having these conversations about what health promoting work could look like in organizations, I hope that you'll join me in Leading System Change. It's a monthly membership group, and it's built around implementing change in our work systems and in our societal systems to promote human health and sustainable productivity. So I hope that you'll consider that. You can find out more at leadingsystemchange.com. And of course, you can find more resources and more information about other online programs that I teach at katherinesandersphd.com. Take good care.